Hi, this is Mackenzie. So I agree that there is value to quasi-experiment methodology. So in the levels of evidence hierarchy that we learned at the beginning of the semester, quasi-experiments are ranked as level 3. So at the top of the pyramid, we have systematic review or meta-analysis, and then we have randomized control studies, and then quasi-experiments. And so in studying the effectiveness of pharmacologic interventions for asthma patients, research will be limited to patients with asthma, therefore studying a specific population without random assignment, which is essentially the definition of a quasi-experiment. It's likely that the observed changes from baseline are due to intervention, and in this specific case, the inhaler regime. Quasi-experimental design allows researchers to look at a specific population, in this case asthma, and study the efficacy of inhaler regimes. However, it's important to be mindful that the observable changes after intervention are correlated. They could be correlated to confounding variables or factors influencing both independent and dependent variables. So if unable to find research about young adults or older adolescents, the nurse practitioner should try searching for studies with participants who are the same ethnicity as Cassandra. Sometimes the reported side effects or efficacy of medications can be impacted or vary with race. Another option would be to see if there are studies involving the same treatment regime the nurse practitioner is considering, but with maybe a broader patient population, such as adults. Another option would be to see if there are studies with the same demographic as Cassandra, like age and race, but they're using a different pharmacologic intervention. Perhaps research points to different treatment interventions for Cassandra's demographic.